As we come to the end of the month, I am pleased to share a roundup of stories from across the Trust. We kicked off February by celebrating National Apprenticeship Week, highlighting how apprenticeships here at the Trust help individuals develop essential skills, gain hands-on experience and progress towards fulfilling careers.
We have a range of apprenticeships available here within the Trust, and these cover clinical and non-clinical roles as well. And the apprenticeships are available starting from level 2 all the way up to level 7. So a level 2 apprenticeship will be equivalent to GCSE qualifications, and then level 6 and 7 will be equivalent to a bachelor's degree or a master's programme. Anybody above 16 years of age can apply for an apprenticeship, and that includes our staff that work within the Trust as well.
When college didn't turn out well, one of the first jobs I worked was in a takeaway. I can recall on my first shift, my manager's kind of telling me, what are you doing here? And that was kind of the eye-opener for me. I didn't really know about apprenticeships to start off with, because obviously when you hear the NHS, you know about the clinical, the nurses, the frontline staff, you could say, but you don't realise the amount of opportunities you can get from a non-clinical perspective. With both apprenticeships that I've done, it's helped instill a bit of confidence in myself.
I'm a huge advocate for apprentices because, having obviously done one myself, I sort of really understand the benefits that by doing an apprenticeship programme it brings to the individual and the Trust and the team that you work within as well.
Thank you, Faye and Hamed. We also learnt more about the early success of student-supported services, a new and innovative student placement model at St Luke's Hospital that empowers placement students to turn their ideas into meaningful, lasting services that support patients, strengthen teams and enhance care across the wards.
We're piloting student-supported services, which is a placement model that offers students a real-world, authentic learning experience. Instead of observing care, students will lead on and actively contribute to patient care.
From the get-go, we're sort of given a lot more independence, a lot more autonomy in what we do.
So we've got this referral from your doctor regarding you having problems with your breathing. Yes. Could you tell us a little bit more about that, please?
Yes.
It started off with observing our supervisor, getting familiar with how the appointment's going to run.
When students started, we only had capacity to see 2 new patients a week. We'd regularly receive 4+ referrals a week. It doesn't take a maths degree to understand that those numbers don't work. So we were trying to look at different ways to manage our waiting list and to make it a better service for the patients.
I think it's been valuable as we've been given a lot of responsibility, and especially at first it was really nice knowing that you're not alone, you're not running the clinic by yourself.
Our waiting list in the 10-week trial that we're halfway through has gone from 16 months to 6 months, so it's already shown quite a significant improvement. If we keep running this, then it absolutely can get rid of our waiting list, and there's no reason why it couldn't be spread to other areas and have the same effect.
On the podcast this month, I met with Dr. Mary Hill, cancer psychologist, and Mandy Blackburn, breast care nurse, about how the Trust supports patients with the psychological implications of a cancer diagnosis and supports them throughout their cancer journey.
We know that cancer is often a challenging disease with harsh treatments, but one of the most valuable things we can offer to people who are affected by cancer is someone to be with them, to hear how they are, if they want to talk, and really most importantly, to let them know they're not alone. Over and over, the evidence shows that people can achieve more, cope better, and even be more well with that connection and warmth and love from other people. So that support, wherever it's comes from, is so important.
Thank you, Mary and Mandy. Finally, here's a look at some other exciting things that have been happening around the Trust this month. Well, that's it for this month's update, and I look forward to sharing more stories from the Trust with you next month. Don't forget, all our latest news and updates can be found on our social media channels, LinkedIn, Facebook and Instagram.